Trigger warning. This video talks about very serious topics relating to mental disorders. If you experience triggers over this topic, it's recommended not to continue watching. Have you ever referred to yourself as so OCD whenever you've just finished organizing your room? Have you ever unofficially diagnosed someone with OCD because they tend to double-check things from time to time? Have you ever met a person who has OCD and thought, oh, it must be so easy for them. They like to be organized and clean. Or have you ever seen a person with OCD and thought that they just need to simply tell themselves to stop and have willpower? All these actions and thoughts are actually very untrue and unhelpful to people with obsessive compulsive disorder, or for short, OCD. When one has OCD, studies have revealed that the brain has excessive activity in the frontal cortex, specifically the orbitofrontal cortices, which controls decisions making, and basal ganglia, which controls your ability to move. And according to a DSM-5, OCD is characterized by the presence of obsessions and/or compulsions. You may wonder, well, what do those terms even mean? Well, obsessions are classified as persistent and recurrent thoughts, urges, or images that are intrusive and unwanted. As for compulsions, those are the response to obsessions or some type of quote-unquote rule that a person feels driven to do. These compulsions are very repetitive. This broad definition gives OCD more variety beyond any cleanliness or organizational behaviors. Sure, an individual with OCD can experience obsession/compulsions when it comes to cleanliness, but there are so many other behaviors and thoughts that people with this disorder have. An example of this could be hoarding a bunch of items in one's home, being very faithful to a particular religion, nail biting, and counting/numbers, just to name a few.
I started exhibiting some of the more obvious versions of OCD, like hygiene and counting. I feel the need to, for the hygiene aspect, it's like, I feel the need to constantly overkill with washing my hands, washing them excessively, and disinfecting things constantly. And then for the counting, if I sometimes, like for example, when I leave the house, if I don't check if the door's locked 2 or 3 times, I won't feel like it's locked. What's going through my head is usually because all my obsessions and compulsions I don't want. So typically whenever I'm engaging in my compulsions, I just try and get it done as fast as possible, as it's not enjoyable for me at all.
But it's not that bad, right? It doesn't sound so severe, right? This is very untrue, as OCD has affected the lives of people with this disorder drastically, particularly in the social aspect the most.
In regards to my work and school performance, it hasn't really affected much. I still feel like I perform the same. However, I do notice it has mostly cut into my social opportunities. There are moments where, say in the middle of a party, I suddenly feel the need to engage in one of my compulsions, and it takes up time I could have been spending with others. And then sometimes I just don't go to certain things altogether. This is a more strange example, yet I feel like it shows the extent of like I go to hide my compulsions at times. I remember one time at a party, like I faked getting like a mess on myself, so it would be more, or like in the eyes of other people, would be more rational for me to go and wash my hands and stuff. Because in reality, the thing that brought the obsession to me in the first place was me just getting like something minor on my hand, and then I purposely got myself dirty just so it would be more rational to outsiders. My mom has done something which I don't think should be done at all with people with OCD. She's basically enabled like my obsessions and compulsions at times, which is something you don't want to do with someone with OCD. And the rest of my family members, I don't really talk about it much with, so they don't really know the extent of my OCD. She knows how attentive I can be to the slightest misplacement of things. She tries to keep as clean as possible because she knows it bothers me.
It is good to note that in very severe cases, OCD can make it difficult to do things efficiently, which can make it hard for those who have it when it comes to work performance. Just imagine a person who has obsession/compulsions about numbers as an accountant, or a person who has obsession/compulsions about hoarding as a housekeeper. Another big issue among those who suffer from OCD is that it could genuinely confuse someone about their character. A great example of this is something called suicidal OCD, in which someone has obsession/compulsions about ways that they'll kill themselves and the anxiety that they'll actually end up doing it, even though they know they don't actually want to end their life. They might look up all the ways people successfully attempted suicide or see a weapon they could use and think about it and have this irrational fear that they actually will do it. This is one major way that people can end up judging people because of this mental disorder. People won't understand the intrusive nature of these thoughts and get freaked out and assume the worst of people with this mental disorder. It is important to note that intrusive is a word that describes annoyance at something unwanted. But what are ways people with this mental disorder can seek help?
So I've been in therapy consistently since June of 2018, and at first I didn't take it that seriously because honestly I didn't want to be there, and over time though I eventually realized I did need the help though. So as I've gotten older, I've gotten more engaged in therapy and actually just done the work on myself to make my obsessions and compulsions more manageable. And also something that's helped me is getting back on medication. I tried medication in 2018 and I didn't have the most positive response to it, so I got off of it. Yet I've given it a second chance and I've gone on it again and I've noticed massive improvements. I definitely feel like I'd be in a way worse place without medication. If therapy alone isn't enough for you, I would definitely look into getting medication.
It is important to note that one must take extra precaution when it comes to taking medications to help manage their disorder. Medication should only be used as prescribed, and there should be no intaking of drugs such as tobacco, marijuana, alcohol, or any other hard drugs as a form of quote-unquote self-medication. Because while it may relieve some anxiety in the moment, in the long run, these kinds of drugs can actually make this disorder feel a lot worse. Always consider the side effects of any medication you take, considering other issues that may be going on in your life and your lifestyle. Some side effects of medications can include shift in weight, trouble sleeping, and nausea, just to name a few. So it's recommended to be aware of your personal struggles before taking prescribed medication. And on the topic of non-prescription drugs, be cautious when taking prescribed medication simultaneously, as it could reverse the desired effects of the medication or it could get you intoxicated a lot quicker. But besides the person with OCD seeking help themselves, you can be a good support to someone suffering with this disorder. Here are some of the things our guest speaker has to say in regards to helpful ways you can help someone with OCD.
Definitely not enabling their obsessions and compulsions. You don't want to, if a person with OCD, for example, is asking you for lots of reassurance, you just need to be very brief and not feed into it too much. Also, another thing that would be really helpful is to be very open-minded, not judgmental, because OCD is, in my opinion, a very misunderstood disorder. Anyone who is supporting someone with OCD should just be very open-minded, non-judgmental. If someone you suspect may have OCD and they're not already in treatment, I would highly suggest you to encourage them to get into treatment. Also, educating yourself about the disorder is also really helpful so you can understand things from our perspective.
As a society, we tend to lack empathy for those who are suffering from mental disorders like these, especially the non-romanticized mental disorders. We've gone a long way in terms of improving our mindsets and realizing over time that those who are mentally abnormal aren't possessed by the devil and require an exorcism or something stupid like that. But we still have a long way to go. I'm dedicating this video to my very special guest, Sasha, who I've seen struggle with OCD since the beginning of their diagnosis. Having them as my friend for the longest time has taught me that in every mentally disordered mind, there is still humanity in that person, and I hope everyone here can look at people with mental disorders in the future with an open mind and heart. Be cautious when taking prescribed medication simultaneously. Oh my god! Oh!